This webinar is for tribal or Indian health clinics attesting for the EHR incentive program. It is a two-step process. The first step is registering your provider with CMS for the EHR incentive program. There you'll report the provider's MPI, the payee MPI, which is the MPI number to receive the payment, contact information, and your ONC certificate number of your EHR product. You'll submit the information and CMS will forward it to our system, usually within 24 hours. Make sure and keep reassignment documentation that gives permission from the EP for the clinic to accept the funds. And remember also that the tax liability goes to the tax ID under the payee MPI in Provider 1. The contact information you enter at CMS is very important to get updated. If it's not updated, you might miss important emails about your attestation, and for security reasons, we're only allowed to contact the email entered in the registration. We have a suggestion for your email address if you're concerned about staff turnover or if you want to share the EHR duties. It's encouraged to use a generic email as opposed to an email with a name in it. If your email has a name attached to it, then we can only communicate with that person. An example of a generic email might be awesomeclinicehr@yahoo.com. Most large facilities use this method, and you can only use a generic email for the EHR program, not for your regular Provider 1 duties. Automated emails will be sent only to the contact's email address. If it's not updated, you will miss important communication. To change your contact information, it must be done in the CMS registration, not in EMIP, and then it has to be submitted in order to update our system. In order to find the CMS Medicaid User Guide, please go to www.cms.wa.gov. Provider types eligible for the Medicaid EHR incentive program are listed below, side by side with the Medicare. Note that they are a little bit different, and also note that naturopaths are included with MDs in the Medicaid eligible providers. The second step of the process is once CMS transmits your registration to us, you'll receive automated emails with your NLR number, which is also your registration ID, a domain number. This will not be your group domain number, logon, and temporary password. Once you're able to log in, you can begin the attestation. To access our website, please type in healthit.wa.gov. When you access our website, look in the left-hand column and click on Resources. After you click on Resources, look in the center of the page and click on Electronic Health Records, EHR. Scroll down under Eligible Providers and you will find various guides to help you. There will be the EP, AIU, and MU EMIP User Guide, the Patient Volume Worksheet, and there's a new section for tribal attestations. Indian health clinics are able to use the FQHC or RHC rules when attesting for EHR incentive funds. This makes it a little easier to qualify. Special rules do apply to EPs attesting as FQHC, RHC. Please see our user guide and white papers on our website for details. What is an FQHC? Federally qualified health clinics are located in underserved populations and offer a sliding fee scale or charity care according to income. Tribes are included in the special rules for FQHC, but do not receive the same federal grants. CMS has made it a little easier for tribes to qualify due to the charitable care they give. If you don't meet 30% by using the Medicaid-only encounters, you have the option to use medically needy option. This includes charity care, sliding fee scale, and CHIP. If you choose to use the medically needy option, your EP must practice predominantly in an FQHC, RHC, or tribal clinic. That means more than 50% of their time. This must be over a 6-month period within the previous 12 months or the previous calendar year. You may be asked for a letter to verify this information. What's an encounter? An encounter is a provider's visit with a patient, paid or unpaid, billed or unbilled. No matter how many procedures are performed during that visit, it's still just one encounter. If the patient sees a different provider type within your clinic at the same time, that is considered a separate encounter. For example, patient comes in and they see their PCP for a cold, but then they have a mental health visit with another professional right after that in your clinic. That would be 2 encounters. What are your total encounters? Those are the encounters of all your patients within the 90-day period of your choice. This 90 days has to be either within the previous 12 months or the previous calendar year. When you're testing as an individual, this will only be that particular EP's encounters. If you're attesting with group proxy, you must include the encounters of all professionals in your office that see clients, whether they're able to attest to the program or not. In order to count your Medicaid encounters, use the same rules above for group proxy or individual, but only count the Medicaid encounters, paid or unpaid, billed or unbilled. Only include your managed Medicaid, Medicaid primary, Medicaid as a secondary or tertiary. CHIP or state-funded Medicaid programs are not to be included. Charity care is a written agreement made prior to the visit that there is no charge for the encounter. It is not a bad debt write-off. CHIP is not considered Medicaid but can be included if you're using the medically needy method only. Sliding fee scale is similar to charity care, but they qualify for a reduced rate based on income. Like charity care, it must be a written agreement in advance of the encounter. If you have PAs in your clinic, there are special rules that apply. The only time a PA is eligible for the program is if they work in a PA-led FQHC, RHC, or tribal clinic. They can be the primary provider, which means they work more hours than other providers in that specific clinic, or they work in a clinic led by another PA. We do require a letter from the medical director or equivalent explaining how they meet this criteria. Please see our resources for contact information and website information. There's information here for both us and for Department of Health as well as CMS.